Hi, listeners. Today we have Trevor, and he is going to educate all of us on his transgender journey. Welcome to the podcast, Trevor.
Thanks, Robin. I'm excited to be here. Thanks for having me.
Today, I am hoping that you can educate myself and our listeners because this is a very important topic. It can be very serious, but I think that there's some pieces that we'll find could be a little lighthearted and a little fun. Talk us through some of the terminology, your experience, what you've encountered, and let's talk through it.
Sure, sounds good. First, a little disclosure here. As a transgender man, I can speak from my own experience. I can't speak for the entire transgender community, but there are some experiences that most of us have in common that we can talk through. For me, it's important to remember that there is no one way to transition. There's no right way to transition, and there's no one surgical procedure that everyone would have that would make them trans. So everyone's identity and everyone's journey is going to be a little different. And as we talk through my journey today, you'll get a glimpse at what it might be like for some portion of the population out there. I'll start. I like to say, in the wonderfully accepting state of South Carolina, there was a baby born in the late 70s, and the doctor held the baby up and said, "Congratulations, it's a girl." We all make mistakes. So born in South Carolina, but brought up in Massachusetts, and thank goodness for the current political climate. Massachusetts is the environment it is, where we have protections for LGBT folks here, and the company that employs me is very open to LGBT employees. We have a very strong DE&I team. I think you're going to start seeing DE&I turn into DEI and B, diversity, equity, inclusion, and belonging, which is the next step in the evolution here. So for me, I knew I was trans when I was about 7 years old. And growing up where I was, all the other kids that were my age were boys too, which is great. You know, we cut across people's yards and climbed trees and played in the mud and played in the tide pools. It didn't have any representation for trans or LGBT people on TV, on the radio, in my life, really. So didn't have any words. And I think, question?
I do. I already have a question.
All
For
right.
those people that don't know, can you explain the LG what it all means? Because not everybody
Absolutely.
knows that.
That's a great question. So we tend to use LGBTQ plus to cast a wide umbrella over the entire community. So L, lesbian, G, gay, B, bisexual, T, transgender, Q, queer. And queer is a word that not everyone identifies with, but a lot of the community is starting to reclaim. It was used as an epithet for a long time to insult the community. Then you get into I, intersex. And intersex is a condition where a person is born either with external genitalia that appear both male and female, or chromosomal difference, or hormonal difference that brings about aspects of both male and female in the body. It's a biological condition. Years ago, you would have known that person as called a hermaphrodite, which is a very outdated, unscientific term. So intersex is the correct term now. LGBTQIA, you can get into asexual, which is a person who does not have any sexual attraction to male or female, or anyone really. Agender, a person who doesn't feel like they have any sense of gender whatsoever, either male, female, neither. And there are actually many more letters that would be part of that umbrella. We tend to use the LGBT because those are the ones that people are most familiar with if you're not part of the community. But folks are welcome to identify their own sexual orientation and their own gender identity as they see fit. And it's important to realize that gender identity and sexual orientation are two separate things. Gender identity is who you know yourself to be, who you are as a person, and sexual orientation is who you're attracted to. It's also important to recognize that not everyone's gender identity is going to match their gender expression. Gender identity is the internal ID, who I know myself to be. My gender expression is how I appear to the world around me. So right now I am sitting here with my beard, my glasses, a t-shirt, bald head. I express myself as male, and I know that's who I am inside. I've always been male, even if they didn't recognize that when I was born. So those are, a little overview. It's very common to kind of lump together sexual orientation and gender identity, but they really are two different pieces of a person. And it's important to know too that everyone has a sexual orientation and gender identity, not just members of the LGBT community. A person who's straight, their sexual orientation is straight, heterosexual. A person who was born and identifies with the gender they were born in, um, we would call that cisgender, which means same side of gender. Trans is be across gender, so that's the Latin terms for those words. So often now you hear cisgender, that's your gender identity, and transgender. That's I am part of the transgender community.
One more question before we go on.
Sure.
Amazing information, and I didn't know half of that, so I greatly appreciate that. When you were talking about transgender, you had said something about surgery. Do you have to have surgery in order to say you're transgender?
Absolutely not. So everyone's journey as a transgender person is going to be different. You'll have under the transgender umbrella, male to female, female to male. That means female to male. I was assigned female at birth, and I've transitioned to male. Male to female. I was assigned male at birth, transitioned to female. You also have people who are non-binary who don't feel on either end of that spectrum. There's many things that go into the medical decisions to transition. Some people are simply unable to have those procedures because of other medical complications, because they lack health insurance, because they live in an area where the surgeries are not performed or medical intervention is not available to them. It's quite a process to have surgical procedures. I've been out as a transgender man for 17 years. My first year of transition, 2005. Actually, tomorrow comes up on my 17th anniversary of my first hormone shot. So 17, the number 17 popping up again, December 17th, 2005. Um, and to get that shot, I had to be in therapy for a year to identify myself as someone who is of sound mind and body to be making this decision. I had to have letters from a therapist who is versed in LGBT transgender gender care, as well as from a physician who is able to attest that my physical self is able to handle the shots. So that was just to have that first step. And then for surgery, my first surgery that would help me align my body with my inner mind and soul was to have a double mastectomy with a nipple reconstruction, and that wasn't covered by insurance at the time. I had to travel from Massachusetts to San Francisco. I had to be in San Francisco for 2 weeks. I paid out of pocket for travel, for the hospital, for the surgery, for the anesthesia. And that I had to have additional letters to be able to have that surgery. So it's not like you're doing this on a whim, and I think that confuses a lot of people too. I struggled with my gender identity for 27 years before I was finally able to be out. To me, that's 27 years of knowing in my head that something with my body was not right. But to my parents, it looked like, well, this is an overnight decision. What are you doing? Like, are you sure? Why can't you just stay the way you are? Luckily, my mother was very accepting. My father had since passed away, but my grandmother was in that mindset of, we're just going to ignore this because I don't like confrontation, and we're just going to kind of sweep it under the rug. Um, Fast forward, that was the only surgical intervention I had for a very long time. It didn't take long for testosterone to start migrating the hair off the top of my head onto my chin, and for my voice to start dropping a little bit, for the body fat to start reshaping from areas, hips and chest to stomach. Um, so even your pores, your skin gets a little more coarse, your hair grows. Um, I'm very lucky. I would say passed very early in my transition, and with that comes some funny stories about male privilege on the up and down. I I like hockey. I had tickets to the Bruins. I loved going to the games, and I liked mouthing off. And when people saw me as female, they ignored me. I mouthed off at a game, one of the first games, people read me as male, and the guy in front of me stood up and turned around and says, "Do you want to take this outside?" And I looked up at him from my seats and was like, "No, no, I don't. Would you like another beer?" So even things like going to get the oil
Interesting.
changed in my car, it's one of those, as a female, they're like, okay, ma'am, now we're doing this. Now we're doing this. Okay, ma'am, we're gonna check that. Okay, now we're gonna do this. Same chain of oil change places. You here for an oil change? Yep, that's it. There's no other discussion. To buy a car, same thing. They talk to me through the whole experience. It's like, well, no, I don't know anything about cars. It's her car. You need to talk to her. So it's interesting, but so it was several years again between procedures because I didn't feel like I needed anything else at that time. Coming up, the next procedure I had related to transition was a full hysterectomy, which was done laparoscopically through Beth Israel in Boston. The surgeon there started treating transgender men because they were not able to find other surgeons in the area who would treat trans men. It became a word of mouth as this is a surgeon that'll do it, which is really funny because the anatomy is the same. It doesn't change really. It's still a uterus. It still needs to leave the body. That was an interesting time because I I'd been with the company I was working for about a year and a half, and was out to a lot of people at work, but not everybody. And we're a medical device company, so when people ask questions, they want details. And very very well-meaning people would ask me what I was having done, and at the time, I told them I was having a non-cancerous mass removed from my abdomen. And of course, they're like, "Oh, well, what is it? Do you have a surgeon? Who's your surgeon? What do they do?" And I didn't really want to get into it because I know we make some of the devices that are used in these surgeries. Um, but again, like I had legally been identified as male on my paperwork for quite a few years now. We're talking now, this is 2016. So it had been 10 years between procedures for me. It was important to have my hysterectomy because the longer that's in there and not producing hormones, the bigger risk it's going to turn cancerous and cause problems down the road. So that was a fairly big surgery. Again, thought, well, that's as far as it'll need. Don't really need to go any further than that. Looking down at the hospital bracelet and seeing an F on it after having M on all my paperwork for so long was a little disjointed, but at least insurance paid for that one. And then most recently, I've been on a multi-year journey for phalloplasty surgery. Stage 1 took place on
Can you
November
say that?
2nd.
Sorry,
Sure.
Trevor. Can you say that one more time? I have never heard of that.
Sure, phalloplasty, which is construction of a phallus.
Ah, okay.
Yep, and that's another surgery that there are very few surgeons in the country that do it. In Massachusetts, there's one. I went to New York for my surgery because when I started the process, there wasn't one in Massachusetts. So it was almost a year from the waiting list to get the consult, and then 18 months from the date of the consult before surgery could be booked. It's a multi-stage surgery. They can't do it all at once.
Uh-huh.
So I had to travel to New York, had to be in New York for 40 days away from home in a rental area because of the weekly appointments. And the surgery involves a lot of vascular risk when they take the graft. So for my graft, they took it from my forearm. I don't know if you can see
I
the
can
scar
see
on my
that.
forearm.
Yes, I can.
That has become phallus. And then they take a skin graft from my thigh to cover my forearm. So there's a lot of risk of failure with that first round of grafting. So you have to be close to the surgery center, which means you need the means to pay for that. Again, very lucky to work for the company I work for. They cover a portion of travel and lodging, as well as the insurance to cover the hospital stay. So 5 days in a cardiovascular ICU, along
And
with.
why did you need to stay for 40 days in New York?
Because the risk of failure is so high, they want you less than an hour away from the hospital in case something fails.
Okay.
And this is not a surgery where it's, are you going to have a complication? It's what's the complication going to be and how bad is it going to be? So there's a very high likelihood of complication. There's a risk of no longer retaining sensation. There's a risk of permanent loss of function in your hand. There's a risk that it just falls off. So luckily that didn't happen.
Yeah, I want to be really clear for our listeners. Your journey so far, none of this is just a whim. You didn't
Oh
just
my goodness,
decide
no.
to change this. You didn't just decide to go have surgery. You didn't, and I do think that there's an overwhelming thought out there, which is completely incorrect, which is why I'm glad we're correcting these thoughts today, is that these are long, drawn out, self reflecting, uh, for years, these decisions and the number of, I'm going to call it hoops, but just to make sure that this is really the direction in which you're going. So I'll overgeneralize and say, any of these surgeries, everybody else has to do something probably somewhat similar in order for these surgeries to take place. So you don't just call up and say, hey, I want this surgery, and this surgery. I just want that very clear. These are long drawn out thoughts, discussions, planning. This is quite the journey.
Absolutely. And standards of care have changed over the 17 years that I've been on this journey. But even this surgery, before I could even have that first surgery booked, I had to have 3 letters attesting to my ability to make a sound decision. So I had to have one from a psychiatrist, I had to have one from my licensed clinical social worker, and I had to have one from my primary care physician. I had to have an aftercare plan that included who is going to stay with you 24 hours a day and help you change your dressings and get out of bed and do all this stuff. So yes, it is not an overnight decision, and there are so many safeguards in place to ensure that you're making those sound decisions. And I think that's really critical right now. A lot of the tension is situated on minors and their process of transition, and it's really important to talk about what it means for these kids, especially in states where they're banning medical care and they're banning the ability to play sports. In any of these states where you're seeing these bills proposed, anytime there's one that comes up, you see an increase in calls to the suicide prevention hotline, the Trevor Project, not related, go up 150%, and we already have an over 40% suicide rate in the transgender population. What transition means for a kid is very different from what it means for an adult. If you're a minor, your transition really starts around social transition, using a different name, being allowed to dress differently, cutting your hair or growing your hair out. When you reach a point where you're hitting puberty, you are in discussion with your primary care physician, a team of endocrinologists, licensed clinical social workers and therapists, and you're making those decisions of, do I go on puberty blockers or do I not? And there's a big false narrative on puberty blockers being experimental. They've actually been used for decades in cisgender kids to treat precocious puberty. So if you have an 8 or 9 year old who's going into puberty already, you're using those same drugs that are being prescribed for transgender kids to stop their puberty in that 8 or 9 year old. So these are not experimental drugs. It's a different use for the drugs with the same outcome. You're just putting the pause button, which is sometimes all it takes to really work through some issues for some kids. And other kids, it's like, nope, yep, this is the right thing for me. Now you have options for preserving your genetic material through sperm or egg retrieval prior to continuing through any processes.
Hmm.
Those weren't really talked about when I was going through my beginning stages. It wasn't something I had ever asked about, but now it is built into the standards of care for these kids, and it is something that's discussed with their parents, discussed with them. If there's ever even like a thought of maybe I would want to do that later in life, then they encourage, hey, let's do that. Then let's store it. Which is fantastic. I'm a dad. My wife and I have a 3-year-old through a donor, and it's absolutely the most wonderful thing in my life. I always knew I wanted to be a parent. I also knew that my genetic material did not need to be passed on to that child. Um, but it's a really personal choice, and it's awesome that the kids that are coming through now have the ability to make that choice. Again, that puberty blocker might be enough, and it might be enough for that kid to say, you know what, this is how I identify. I don't need any medical intervention. It also ties into sports, right? So if you've got a 12-year-old who has never experienced male puberty, who goes on those blockers, then the whole argument of they have an unfair advantage because they've been through male puberty is null and void. So you're creating a problem and then creating a solution for that problem by not allowing these kids to access a level of care that's recognized by every major medical association in the United States, that has been tested for years. So it's disheartening to see the backward slide that we're seeing right now. It's terrifying for kids that you're now seeing families flee states where some of these laws are being enacted, because the parents could be accused of child abuse for simply providing for their kid the recommended course of treatment that's been agreed upon with their physicians. So it's a bugaboo. It's being used to scare people. It's not going to make fewer trans people. It's just going to make life harder for the ones that are out there.
Wow, that's terrible.
It's
That's
scary,
really
scary,
sad.
scary.
Yeah.
We have friends that are in the Midwest with a 9-year-old transgender child, and they're already on edge. And if there's more laws passed in their area, they've already talked about could they transfer to Massachusetts or could they transfer to one of the other states where our company has an office. So it's tough. It's tough to watch. It's tough to support them from afar. And I think one of the most important things I can do to support them is to come on podcasts like this and share my story. I do share my story with other businesses, mostly in the business environment, of how to welcome trans and non-binary employees into a workplace. And part of that is looking at your policies to make sure that you can support workers and their families who need to access that care. The company I work for, they thought they were really progressive and really forward thinking, and when it came down to it, they had the right policies. They had policies, but it took someone who was in the community to look at those policies and say, "Wait a minute, here's how it actually impacts." One of those things was bathroom location for gender neutral bathrooms. Found out one of our facilities had all of our facilities have them. In one of our facilities, they were located on the loading dock, which meant you had to have secured access in order to get out there, which meant your manager, you needed to either out yourself to your manager or be escorted by a security guard anytime you wanted to use the restroom. So we brought that to the attention of our facilities team and our construction teams, and they said, "Oh, wait, no, that's not right. We don't want that. Let's fix it." And now they have a new standard of whenever there's updated construction to a building, they're building a neutral restroom right there with the men's and women's rooms. And in the meantime, while buildings are still sitting waiting for their updated construction, they changed all the signs to say, "Here's the location of this restroom, and you can use whatever restroom aligns with your gender identity." Same with reproductive assistance benefits in the health insurance policies. There was a policy, but it didn't treat straight couples and lesbian, trans, single people equally. And we called that out and said, "Hey, wait a minute, these policies are not equal." And the HR team said, "Oh, right, they're not. Let's fix it." So it wasn't that they were trying to punish or discriminate. It was no one with that knowledge, no one with that personal experience had looked at those policies to say, "Here's how it actually impacts." So I think that's one thing with our younger workers coming in that I've seen struggle. They see these policies or they see something like this and they're like, "They're discriminating against me," and they don't have the patience necessarily. Not just younger coworkers. We see it across the board. There's this "I need this changed now," and they want to bang their fist on the table and yell, and they need to fix it immediately. And for large companies, especially, that's a very slow ship to turn. You have to, what I'd say is, take off your activist hat, put on your advocate hat, and just keep the pressure on. Like, come up with your arguments for why it needs to be changed, build your business case. And there is a huge business case for diversity. You see an increase in profit, an increase in worker productivity, a decrease in sick time when you have an inclusive environment. And replacing workers who leave due to discrimination is a $64 billion cost to American businesses every year. So we don't want to see that turnover. We want to see people happily employed, engaged in their workspace, and empowered to bring to light some of those issues that are impacting them.
Yeah, I worked in HR for 7 years, and while the general public would think, "Oh, it's so easy to replace all these people," yes, we can replace them, but you're not looking at everything else that goes on behind the scenes and what the real cost is to an organization, where just a little bit of education, sharing of knowledge really does go a long way, changing of like the where the gender neutral restrooms are, inclusivity, all of that goes even further. And that's really where we need to go.
Sure. I thought 6 months into working for this company, I wasn't really out of the closet. I didn't think I was going to be. And I already thought I was going to have to leave the company because the person across the aisle from me started telling transgender jokes. And I was getting really uncomfortable with it. And I eventually got so tired of it, and I realized the company has a zero tolerance policy for this. So why is everyone putting up with it? I called him into a conference room and I said, "What are you doing? You know who around you is upset by this, who might have trans family, who might be trans themselves." And he, the last thing I expected, he started crying, and he said that he had a family member who was transitioning and didn't know how to deal with it, didn't know anyone that was trans, didn't know where to find resources, how to support them, and his way of dealing things was with inappropriate humor. So I made the decision then to come out to him. We talked for probably 2 hours in that conference room, let him ask me all the awkward questions, all the personal questions, and he never told another transgender joke. But he did spend the next couple months terrified that HR was coming to walk him out anytime because he thought for sure I had gone to HR to complain. And I didn't. That was between the two of us, but it really impacted my career trajectory at the company. It kind of lit a fire under me to be out to see the impact it had on him. I knew there were other employees that needed that as well, and it led me into a professional diversity career. I work in supplier diversity now, helping people from all backgrounds work to get business with the company that I work for.
And I bet that's incredibly satisfying.
It really is. It really is. It's unique too. I work a lot with the National Gay and Lesbian Chamber of Commerce, and they have a cohort of transgender and gender nonconforming, gender non-binary businesses, and it's fun to get on calls with them. And they're always like, "Oh, I've never met a supplier diversity person who's also trans." And it's like you're speaking the same language. You're not worried about presentation or.
Yeah.
Um, it's really interesting.
Yeah. Can we go back to your surgery? You were
Yeah.
showing me your arm graft.
Yep.
How did that surgery turn out?
It's turned out well so far. I still have
Okay.
some wounds that are healing. I don't have, this is it for range of motion in my hand right now. So I'm hoping that comes back because I'm not able to do a lot of the things that I like to do. Um, it's impacting pretty much everything. The phallus itself it's not functional yet. There are still 2 more stages of surgery to go for that. The next stage, they'll connect the urethra, so I'll be able to stand to pee. And then the final stage, they'll add a device that allows it to be erectile. Although those are a little ways off. Stage 2 will be in February, mid-February, and then stage 3 will be approximately 3 months after that, as long as there's no complications. High risk of complication with this surgery, especially with the urethra. The urethral lengthening is a very complex piece of the procedure, and that is the piece that's most likely to fail. So worried about it, but it was what I needed. There have been various points in my life where I felt really strong gender dysphoria. First time was when I was 13.
Yeah,
And
let's
for
talk about
me,
that for people.
yeah, absolutely. So going back, I knew when I was about 7 that I was a boy, but no one else around me recognized that. Started really to withdraw from people around me. Became the smart kid that didn't have a lot of friends, but did their homework early and liked to read. When I was 13, my mother took me to get a haircut, and it was my 13th birthday. The hairdresser found out it was my birthday and gave me the gift of a manicure. And I knew this was something that was very kind, very generous. It was not something that 13-year-olds got in the 80s, early 90s, early 90s by that point. Um, and I hated every single second of it. I was irrationally angry and upset, and like it gives you this feeling of vertigo, like the whole world is tipping sideways, and you don't know whether to go with it or to stand up. Sweaty, like real physical symptoms. And I couldn't explain it. I didn't have the language. It was before Google. I couldn't Google and say, "What's wrong with me?" Didn't have any trans representation on television. If they were in a crime drama, and they were either a prostitute or a gotcha in a love connection. So there was no positive representation out there for how to identify. All I knew was I was a boy and there was something wrong, and I couldn't fix it. And I couldn't wait to get out of the hair salon and peel the paint off my nails. And I felt so guilty for feeling that because I knew this was something that was kind. I knew this was something that was nice, but I still remember the color. It was the same color that my mother wore and my grandmother wore and my grandmother's sisters wore because they all went to the same hairdresser and they all got their manicures there. Um, and that started a period of real depression, suicide attempts. It started showering at night with the lights off so I wouldn't have to acknowledge what my body was really doing through puberty. And that kind of continued through college. I thought, well, if I could just get away from here, college will be better. It's got to be where I am. It's not who I am. Came out as a lesbian in my second year of college because I acknowledged that I was attracted to women. Thought that's as far as I need to go. I don't need to acknowledge the other side of me. Now the words transgender had started to creep into the lexicon. I was familiar with it. Now that I'm in the LGBT community, I'm starting to see people who are transgender, mostly transgender women. I had never seen a transgender man, never heard any transgender man speak or identify themselves. So it continued on. It hit that point. I was dating someone that turned out into an abusive relationship. My self-esteem was at the bottom of the barrel because I was not able to be honest with myself. I was not forming real good, healthy connections. I had a really unhealthy relationship with food. I gained a lot of weight so I could hide my body because I didn't want to acknowledge what my body looked like. And if I made my body unappealing, then it would be no one would look at me, no one would pay attention to me. So developed a real unhealthy relationship with food, unhealthy relationship with other human beings, ended up isolated from my family. When we separated, it was because she beat me and left me on the floor of the house. And that was my last real suicidal period where I thought, as I'm laying on the ground bleeding, um, well, there's some pills in the cabinet. I know there's enough there that when I have the energy, I can stand up and I can end this. And I fell asleep on the floor thinking that. Um, woke up the next day, had a little bit of life left in me at that point, hadn't made it to the bathroom, hadn't taken the pills, and really kind of thought, all right, well, I know where they are, but let's just get through today. And it turned into, I can do this. I can move forward, but I can't move forward. I don't have the energy to continue hiding this whole part of me. I don't have the energy to keep up the charade of not being who I am. So I ended up reconnecting with my family, reconnecting with my mother, coming out to her. And it took a few years to realize that she did go through a grieving period of letting go of the daughter she thought she had to make room for the son that she does have. My brother, on the other hand, has the emotional depth of a spatula. His whole reaction was, my sister's going to California and coming back my brother. So he's good, and most of my family is good. I did have an aunt and uncle who, when I came out, decided they didn't want it around their kids. It's taken a few decades to repair those relationships. Um, a few decades. It's almost been 2 decades, and they're mostly back. Um, so that was, I came out to my family when I was really deciding to go through the first set of surgical intervention, which would be the bilateral mastectomy. So for that, I was a 40 double D, and now I am not. So that was a lot to get off my chest. But prior to having that surgery, I wore a binder for months to compress my chest. It made me look like I was really jacked. It was kind of great. But binders are not always a safe long-term option. Uh, for people who have access to high-grade medical binders, they're uncomfortable at best. They constrict your breathing. They can kind of cut in and cut off supply of blood, of air. They're not comfortable to wear. For those who don't have access or who are not able to be out and access, you see people using a myriad of material from ace bandages to duct tape. And that is not healthy. So another reason that we need to create safe spaces for transgender youth to come out is they're going to find ways to make their bodies comfortable. And those ways are not always healthy in the long term. So giving them access to healthier options is really important. So I almost dislocated a shoulder once getting a surgical binder off because they're that tight, especially for someone that had a chest my size. It was wonderful to finally have that surgery and to be able to walk around shirtless, go to the beach shirtless. Started to develop a healthier relationship with food. On and off, I've had that bad relationship. I still tend to overeat. but I started doing things like running, working out. Testosterone is a wonderful, wonderful, wonderful drug. While they don't give you enough to really put you over the edge, I am in a normal male range of testosterone. They monitor that on a regular basis. When I have that peak high of testosterone in my system, I want to move, I want to do things, I'm up, I'm energetic. Like, I went from being the moodiest person in the world to getting on testosterone and just like, it's great. And it's interesting to, cart and the horse, right? Am I more confident because of my body, because of the testosterone, or am I feeling better because of that confidence? Like, what came first? And now being able to develop healthier relationship with people because I'm being honest with who I am, being able to hold jobs long term. When I was uncomfortable in my own skin, I attributed everything to external environment. I job hopped here, lifeguard, photographer, bike messenger, security guard. It's just on and on. EMT. I joined the army. I left the army. It's just this laundry list of jobs. And I transitioned. I got comfortable in my own skin. 8 years at my previous employer. I'm coming up on 8 years at my current employer. Um, Nice fight with South Carolina to get my birth certificate updated. That was great. It's important to know that state by state, there are different laws for updating your paperwork. Some states don't allow it at all, and that can be dangerous if you are someone who's not able to change your identification, and all of a sudden your name and ID don't match your physical appearance. You can be accused of everything from ID theft through denial of services to different places. Even looking at some of the voter registration laws and voter ID laws, that gets really dicey when you have states that are not going to let a person update their ID to be who they are. Even going through the name change, I still had to publish that in the paper. Like, that still had to go out there and say this person is now this person, and that's a really kind of antiquated way of doing it. In my town, it didn't really matter. No one's reading that section of the newspaper. In smaller towns, that can be really dangerous. So yeah, keep going through. The hysterectomy was more out of necessity than a desire for any additional surgeries, just because that's not a physical appearance piece, right? There's no need for that. When I met my wife, she didn't know I was transgender. We've been together for 10 years now. We dated for about a month before it was going to become very obvious that things were a little different. Um,
How did
and
that conversation go?
Well, this was terrible. So I was single and dating for quite a while, and it was always this balance of, if I told people up front, it was either they either fetishized it or they would like not talk to me at all right from the beginning. With my wife, I didn't tell her at the beginning. We dated for a while. She invited me to spend the night, and I really wanted to, but I just had to say, I want to, but I need to tell you I don't have male genitals. And her response was, okay, I'll probably have questions later. Let's go to bed. And that was probably the best response that ever could have heard. And yep, she had some questions later, but she kind of went along for the ride. And
Yep.
we didn't come out to her family for a few years. We came out to them right before we got married, and it's been great. She's been my best support, my biggest champion, and she's really an incredible person. And to go through this procedure, the phalloplasty, with me has not been easy on her. Phalloplasty, aside from the consult, the trips from Massachusetts to New York, I went through hair removal. She had to have hair removal on the graft site. That was a big expense out of pocket. She was caregiver to me, to our dog, to my daughter, driving me back and forth to appointments because I couldn't even sit up for the first 3 weeks. You're not allowed to sit up at a 90-degree angle. Um, she had to learn how to change bandages. She had to read my medication schedule. It was not easy for her. This is not her career. She's not a care provider. But she did it all without any wavering or complaining. It was all very supportive, and it really came about. We've been through ups and downs like any couple does, and I was having more periods of depression, more periods of anxiety, and I started to recognize it as the dysphoria again. And there's not much else I could take stepwise to do this. It's something I've wanted to do for you know 17 years, just didn't have the means, the ability, the support, an insurance company that paid for it. And it was finally like the time is right for this. We're at a period in our lives where this is a stable place to be able to do this. So it's been great. The recovery has been tough. The not sitting up for 3 weeks is challenging. I'm not someone that likes to sit still, so that's one of the reasons I did 29:029 right before going in for surgery. It was 10 days before the surgery, so it was good to have that one big event to take my mind off of the anxiety going into a surgery like this. You wake up and you don't quite know what's going to happen. Is it going to fail? Is it going to be okay? What's it going to look like? As they wheeled me into my room in the cardiovascular ICU after being in the recovery room, I could see my reflection in the ceiling. And it's the first time in 44 years of my life that I've seen my body and thought it looks whole. And that, I'm all choked up now. Um, that was really an incredible feeling for the first time to just feel solid and present and whole.
And it
Uh,
matched.
and it
It probably
matched.
felt like you matched.
Yes. And it looked like it had always been there. It's never going to fool anyone into thinking it's a natural phallus, but it's there. It's part of me. I guess you could say it was always part of me, but it's there. There's still a few pieces missing, but they'll be attached in the next round. So the next round's coming up February 17th, 3 months, a little over 3 months in between surgeries. And this round, they'll do a multitude of procedures. One is a vaginectomy, so removal of the vagina. It's important to get rid of all the mucus mucosa in there because that can cause infection and complications. The urethral lengthening was done during the first procedure, but they'll connect it, so I'll actually be able to stand to pee. The other two pieces of it are glandsplasty, where they will do the appearance of the glands, and a scrotoplasty, where they'll start putting expanders in to create a scrotum. So if all goes well, the biggest chance of complication with this surgery is urethral failure, either through strictures or fistulas. Something doesn't connect right. I will spend 2 weeks with a catheter through the urethra and 4 weeks with a suprapubic catheter in case I can't void through the urethra itself. So it's again a couple weeks in New York. It's going to be flights back and forth for follow-up visits. More stitches, more wounds, more anesthesia. It's a lot to deal with. More time out of work for this first round, 12 weeks out of work. For that round, it'll be 6 weeks out of work, and I'll still have another one to go. The last one is a much more minor procedure. First one, 5 days in the hospital. Round two, 1 night in the hospital. Round three, it'll be in and out the same day. So much quicker as long as things are healing correctly. But this is just one type of phalloplasty. There are multiple different procedures that are done. Every doctor, every patient may have a different way of doing it. Flaps are often used from the abdomen, from the thigh, from the back, from the forearm. I elected forearm because there's a dual supply of nerves and blood vessels, has a higher chance of retaining sensation within skin, has a higher chance of success. But it's not an easy surgery. Not easy to recover from. The wound on my thigh where they took the skin graft to put on my arm was difficult and painful. Luckily for pain tolerance, I have a fairly high threshold and was not in need of narcotics through the entire recovery period. I survived on Advil and Tylenol. So hopefully with the next round, I'll be able to do the same. I think not having to take the narcotics helped with recovery because I was not out of it. I was able to be present. I did a lot of coloring with my 3-year-old because that's what I could do laying down in a bed. Listen to some books, some old favorites on Audible. It's been a challenge, and I need something positive to look forward to next year. Being whole is just one piece of it. They told me sensation-wise, it could take months to years to even get any type of sensation if sensation returns. So we'll see, which is kind of a weird thing to just kind of wait for. But it's good. And the surgical team was incredible. They were so affirming. Everyone from the receptionist to the hospital staff was just amazing. And that's the type of care, that's the type of dignity every person deserves to be treated with when they're in a medical environment, trans, straight, gay, cisgender, everyone. And we don't always see that in medical care.
Yeah, that's a must. That's 100% patient care. That should be what the gold standard is.
Should be. One of the first people I came out to when I did come out as trans was an OBGYN, and I'd been seeing this person for a couple of years being treated for polycystic ovarian syndrome. When I came out, she told me that for the comfort and safety of her other patients, I was better off seeking treatment elsewhere. So
I'm so sorry, Trevor.
it's unfortunate, but overall, I am in a headspace and a safe space to say, well, if you're that uncomfortable treating me, then I don't want to be treated by you because you're not going to treat me well.
Correct.
So I would rather know. Is it discrimination? Yeah.
Mhm.
Yep. Is it worth my time to fight? No, because I did have other options. There are people out there who don't. And there's a lot of people out there who don't access care simply because they have been faced with discrimination and mistreatment. There's been a lot of times where you go into a provider's office for something and you end up being an educator on transgender identities and transgender bodies, and that's fine in an environment like this where I've offered myself as an educator. But if I have a sinus infection or a cut that needs stitches, I don't want to have to tell you what it's like to be a trans person. I want you to treat my sinus infection. I want you to give me my stitches. Just this last year, prior to my phalloplasty, I developed a UTI last winter and really struggled to find urgent care or minute clinic or any type of telehealth that would treat it because they don't treat men for UTIs. It's apparently not very common for a man to get a UTI. However, having the female anatomy, the vagina, the urethra, I did, and I'd had them before. I knew what I had. But I couldn't even get through the screener questions because they have you put in male, they have you put in this. Finally, did get a doctor on, and before I could even open my mouth, he said, we really don't treat men for UTIs. I was like, wait a minute, you need to listen to me. You need to, I know all your forms, they don't give an option to explain that this is the anatomy I have. So you need to listen to me. And as soon as I explained that, he was like, oh yeah, okay, great. Here's your prescription. Now let's talk about being trans. It's like, okay, fine, I will do this. You listen to me. I will answer your questions. So I know we ask a lot of our medical providers, especially in an environment where they are tasked with giving treatment in a very quick turnaround. They don't get a lot of time to develop relationships with patients. And that can be detrimental to the providers and to the patients. And I know there's a lot of emphasis put on the cost to patient ratio, right? They want to make sure that they're running as efficiently as they can. They're running at the top of their licenses, and that you're not expending more time than you need to with a patient because there are so many people in need out there. But at the same time, now we're asking you to work with that person from a sexual orientation standpoint, from a gender identity standpoint, and it really is critical. We spoke with a urologist fairly recently, in the last couple of years, that treats people a lot for prostate cancer. And he said, if a patient is not comfortable discussing their sexual orientation and sexual activity with their doctor, then it's putting them at risk. Specifically in prostate cancers, there is a test that's done, and if the person is engaged in anal sex, then that test can read a false high and you can over radiate a patient because of that. So if the doctor doesn't know to look for that, then they could be really doing a disservice to their patients in the long run. So we need our providers to be comfortable treating us as people, and treating the whole community as the people they are. Now, on the flip side of things, like, I don't have a prostate, I'm never going to have a prostate. So what's going to happen when insurance says, well, you're due for your prostate exam? Like, well, I don't have one. I don't need to worry about that. And that's important too when you talk about language in a medical setting. Not all men are going to have prostates. There are some women who will have prostates because you'll have trans women, and that's not something that's removed even when that surgery is done, if they choose to go through that surgery. It's also a very complex surgery. So when we're talking about prostate cancer, we need to talk about patients. We need to think about having support groups that include transgender women. We're talking about breast cancer, ovarian cancer, cervical cancer. You might be talking about transgender men. So when we have Men's Health Month and Women's Health Month, there's going to be some crossover in there, and we need to start making room for and being aware of how language impacts the community as well.
Mhm. Very true. Very true. I can't imagine how much courage you had to come out to everybody, family, non-family members. That's amazing, Trevor. That is a lot of pressure that's been put on you for that. How can I and others help you through the rest of the transition and be supportive of the community?
I think number one is be aware of what's happening in your own home state, in your own area. Vote. One, go out and vote. Two is pay attention local, even local races, local policies. Is there a safe space for LGBT people in your community? And our community is hurting right now. The shooting at Club Q in Colorado, uh, it just on the eve of Transgender Day of Remembrance. It's fearful. I mean, Department of Homeland Security is saying that there's an elevated risk of attacks on our community right now. We're seeing demonstrations at even simple educational events. And speaker events. We're seeing hate groups like the Proud Boys show up at places where LGBT people are simply trying to exist. So if you were able to protect, if you see something, report it. Ask your LGBT friends, are you okay? How are you doing? What do you need? Don't assume. Follow their lead. If they say, hey, I could really use an hour of your time just to vent. If you can do that, if you are in a financial place to do so, support organizations that are supporting LGBT people. The Human Rights Campaign, the HRC, the Trevor Project is a suicide prevention hotline for kids. There's a lot of great organizations out there that are doing incredible work to support and facilitate safe spaces for LGBT people at a national and a local level. Here in the Massachusetts area, Speak Out Boston does a wonderful job of having LGBT people share their stories in a variety of environments. Fenway Health and Callan Lord are organizations that are healthcare centers that treat LGBT folks. Fenway Health, full disclosure, I used to serve on the board of Fenway Health. It's where I get my primary care. They have an incredible research arm that everything from diagnosing the first AIDS case in Boston to being a testing site for the COVID vaccines. They are a wonderful organization that can always use support. Learn, go out and read articles, talk to LGBT people, but don't put the sole burden on LGBT people to be those educators. We hear this a lot. It's a big emotional burden in our community. So you can ask them for resources, point them to a website. PFLAG is a great organization for parents and allies that are looking to support LGBT kids. There's a lot happening out there today, and the world's a scary place in general. It's a little scarier if you are a part of a group that has been victimized, has been systemically suppressed. Whether you are being suppressed because of your gender identity, your sexual orientation, your race, your religion, we need to come together and really uplift the community. They say a rising tide lifts all ships. We need to stop drilling holes in the boats of those of us that are trying to float. There's still a lack of protections in this country for LGBT people, especially on the transgender side of things, for employment, for healthcare, for just access to public spaces, and that's scary.
Mhm.
If you have a transgender kid that's going through this, it's a high risk of suicide. Having one supportive adult in your life reduces that risk by 40%. So be that adult, make that safe space. The best way to look at it is when you're asked to be an ally, look at it as if you were on trial, and what evidence would they use to convict you of being an ally of the LGBT community? Do you go to Pride? Do you support LGBT businesses? Do you belong to a gay straight alliance? If there's a local Pride in your area, are you volunteering with them? Do you volunteer with any LGBT groups? Do you donate to any LGBT groups? So there's a lot of ways to do that. And being an ally is a journey, and you start at just getting comfortable with saying the words lesbian, gay, bisexual, transgender, intersex, queer, and you go right up through being that full-on out activist where you're out there at the protest and you're holding the signs and you're wearing angel wings to block out the hate, and that's not an easy place to get to, and there are times where you're going to move back and forth along that journey, as you're safe to do so, as you're in a place to do so. So it's learn our stories. Stories change hearts and hearts change minds, and that's the only way we can grow.
I love that, Trevor. For those of you that are watching on YouTube, Trevor and I both have pictures of Stratton Mountain. We were both there in October, climbing 29,029 feet. I personally did not make 29,000 feet, but what I did make was a lifetime of memories. And I had the courage to ask Trevor questions. And Trevor said, ask me anything on the mountain. And I did. We grew together. As I've mentioned before, I met everybody on the mountain because people passed me at least twice as I was huffing and puffing and trying to catch my breath. But every time Trevor came by, it was always, hi, how are you? I can't wait to talk to you. I have so many questions. I'm trying to understand myself. Please educate me. And it came to the podcast where Trevor is here educating us and opening our minds to a different way of thinking and a different way of looking at things.
Well, thank you, Robin. Sharing that journey with you in October was just incredible. And like you, I tried to talk to everyone that was passing me, everyone that I was passing, which were much, much, much fewer than were passing me. But it was an incredible journey, and it was a metaphor for what transition has been like, a fight uphill over and over and over again, as far as you can go. And not getting anywhere up that hill without your allies, the coaches, the other participants, everyone that was there to volunteer. So looking forward to attempting that journey again as my transition journey continues and as our journey as human beings keeps going.
And our friendship will continue with that.
Absolutely.
Thank you, Trevor. It has been an absolute pleasure talking to you.
Well, thank you, Robin. Thank you for having me.
Thank you. To all of our listeners, stay awesome and keep reaching for your anything.